Hey guys, it's Dr. Beauty, and I am here to talk about a very interesting case that I saw this week at the hospital. So, as you guys may know, I'm doing my OBGYN rotation right now, and we have had a very interesting experience. It's been very hands on, and the schedule is crazy. But, as you can imagine, there are C-sections, there are vaginal deliveries, there are women coming in for pap smears, mammograms, a lot of things. So you're really dealing with the female patient on a whole spectrum of, age and clinical diagnosis. So it's very interesting. Interestingly enough, this week our preceptor assigned us a project to do. And what was that project? To look up neonatal abstinence or neonatal withdrawal syndrome. So this is a syndrome that affects so many neonates, and I'll have some stats listed below, but it's very interesting because it goes hand in hand with the opioid epidemic that we are currently facing. So basically, these babies were exposed to certain drugs in utero. It could be opioids, it could be stimulants, and when they're born, they start having the withdrawal symptoms. And the majority of these symptoms are gastrointestinal or neurological. So they have a cry that cannot be consoled. They could have respiratory demise. They could also have dermatological symptoms as well. They could have tight muscle tone, hyperactive reflexes, seizures, yawning, stuffy nose, poor feeding, and vomiting, diarrhea, dehydration, sweating, and tremors. And they also have a distinct cry, which is described as a high-pitched shrill. Now, this is typically diagnosed by using the neonatal abstinence syndrome tool scoring system, or the Finnegan system. Another one is the Lispitz tool. So these are essentially a listing of symptoms that are assigned points, and if they're present in the infant, they get a point for that. So with the Lispitz tool, if they have a score greater than 4, the Finnegan system, we use a score greater than 8 to determine whether or not we'll intervene. So as you can imagine, there are several ethical implications for this condition. One being, are these mothers fit to take care of their babies? Should we let them continue to breastfeed? Can we screen certain populations that we think are at risk for this disease in advance? And the answer to that is it varies by state. There are so many different laws. For example, when it comes to screening in certain states, the mother has to give consent to be considered in the screening population. Also, when it comes down to getting certain entities involved, such as Child Protective Services, that also is an issue. Just today, actually, we had a patient who was abusing certain substances and presented to the delivery room basically under the strong influence of this drug, and she gave birth to a 8-pound baby boy. However, the social workers at the hospital called Child Protective Services, and now there's a question of the level of contact that she is allowed to have unsupervised with this infant. So, our preceptor is very big on breastfeeding and skin to skin, although our particular hospital is not a baby-friendly hospital. And he was upset to hear that, this lady was not being allowed to see her baby, at least not having the baby in the room. He encouraged the new mother to breastfeed, and the mother said, yes, I would like to, where's my baby? And the nurses said, well, she's going to have to go up to the NICU to be able to feed her baby, because apparently they had observed some aggressive behavior in her earlier on. And so our preceptor was very angry about that, because he really wanted her to bond with her baby. Not only that, but he believes that her breastfeeding and seeing that she's improving the well-being of her son could help her to turn her life around. And the partner that she was with, I don't know if it was her husband or her boyfriend, the baby's father, he seemed like a very responsible man. He's a little bit older, but he was very responsible. He was asking her, are you listening to what the doctor is saying? Are you understanding? He seems like, he's going to take care of the baby and will encourage the baby's mother to do the same. So there's a toss-up. We really, we just saw this case today, so we don't know what's going to happen, whether or not Child Protective Services is going to take the baby, or whether or not she'll be able to keep the baby, and they'll assess. But it's just goes to show you that there's a lot of ethical issues when it comes to this field. So I apologize for not being more frequent with these videos. However, we gotta study for our exams. So I hope that this triggered some discussion between you and your peers, or maybe if you hadn't thought about this issue before, it encourages you to do some research on it, because it is an ever-growing issue in not only the United States, but many countries in the developing world as well. I hope you have a good one, and until next time, deuces.